Let's talk about difference between incised wound, lacerated wound, stab wound. The 13 differences totally. Talking about the manner, incised wounds by sharp objects of weapons, lacerated wounds by blunt objects of weapons, stab wounds by pointed, sharp, or blunt weapons. Site will be anywhere, lacerated usually over bony prominences, stab will be anywhere, usually chest and abdomen. Margins will be smooth, even, clean cut, and everted in inside wounds because here the object is very sharp, weapon is very sharp. Lacerated wound, here the weapon is blunt. So in lacerated wounds, because there is a blunt weapon, so the margins will be irregular and often undermined. Talking about stab wounds, the pointed, sharp, or blunt weapon can be there. It can be clean cut, parallel edges, lacerated if weapon is blunt pointed. Lacerated, clean cut, or parallel. Talking about the abrasions on edge, it will be absent in incised wound, and abrasion on edges will be present in lacerated wounds. Abrasion on edges will be absent in stab wounds. Talking about bruising, no adjacent bruising of soft tissue in incised wound, but in the lacerated wound, bruising of surrounding and underlying tissue will be seen. In the stab wound, bruising will be rare. Talking about shape, linear or spindle. Linear and spindle shape in incised wound varies, usually irregular. Stab wound, linear or irregular. Dimensions usually longer than deep, often gaping will be there, and spindle shape there. They are linear. Talking about lacerated, they vary. The shape varies, usually irregular, usually longer than deep. Stab wounds, depth greater than length and breadth. Depth will be structures will be cleanly cut to depth of the wound, and bones may be cut or may not be cut. Hair bulbs will be cleanly cut. Foreign bodies will be absent. Clothes may be cut. Hemorrhage will be usually profuse. External spotting of blood may be seen because here it is a clean cut, so all blood vessels, nerves will be cut. So the bleeding will be very much. Here, small strands of tissues at the bottom, bridges across margins. Tissue bridges will be there in lacerated wounds. Slight except scalp and external. Crush or torn, fractured bone may be there. Usually present foreign bodies and may be torn. Clothes will may be torn. Structures cleanly cut varies, usually internal and clean cut. Punctured, usually absent. Maybe